Welcome back, everyone, to Potter's Podcasts and Inspirations, where we introduce strategies to promote wellness, learning, and healing. And today, we're going to be talking to Candace Jania and Michael Gonzales, two extremely talented acupuncturists that run the Acupuncture Center of New Jersey. And as I look over their bios, their education and certification is extensive, so I'll actually let them do the honors with explaining their background and how they got into acupuncture. The reason we're doing this is because what I've seen over time is that the combination between network spinal analysis, which is what we do at the office, and acupuncture, they're a great complement to each other. Not only do they both address the nervous system, but acupuncture also addresses the meridian system. And again, Candace and Michael will speak to that more directly. So without further ado, I'd like to introduce the owner and founder of the Acupuncture Center for Reproductive Health and the Acupuncture Center for Family Health, Candace Jania. So first of all, Candace, Michael, thank you so much for agreeing to come on today. I'm really, really excited, and doubly excited that Michael has agreed to start to develop a satellite location for you all down in my office on Fridays. And so we're really, really excited to have you both aboard today.
Thank you for having us.
My first question is for Candace. What is acupuncture, Candace? How does it work?
Okay, well, that's a great question. And thank you again for having us. We really appreciate the opportunity to talk about something that we love tremendously. And to be very simple with our answer, what is acupuncture? It is the insertion of very fine stainless steel needles into specific points or areas of the body that elicit an innate healing response. And we do that. We actually insert those needles into specific meridians and specific points in order to achieve specific things. Each point has an indication that we choose to address whatever imbalance you have going on in the body. But most of the time, it's actually very painless and very pleasant, and people are really relaxed during and after the treatment.
But when you talk about the meridian system, what exactly are meridians?
So I usually try to liken them to the roadway system. Mm-hmm. You have your major highways that are going through the body, just like you have your major highways going through the country.
Yeah, thank you. I mean, that makes a lot of sense to me. It also explains why I think chiropractic and acupuncture work so well together, because even though we're looking at different systems, it is like promoting green lights on every roadway.
So that's exactly our philosophy too. That's funny you said that. So we're basically trying to unblock those meridians. So and that's just in pain, but but that actually applies to everything when we're doing acupuncture. We want free flow, and that's going to cause harmony within the body.
So Candace, that's great. Thank you. So following up, what inspired you to get involved originally with acupuncture?
So I was in 2 years of pre-med, and what happened was I was getting migraines almost every single day, and I was kind of miserable. One day I tried acupuncture, and it completely changed my life, so much so that I called up my mother. I remember the exact day, and I said, I'm going to go to acupuncture school. So and that's what I did. I researched schools, and I started that fall, and I never looked back, and I've been practicing for 15 years. The reason why, it's funny, when I was in high school, I remember there was a job fair, and I saw a description of a reproductive endocrinologist, and I saw that they helped women have babies, and I thought it was absolutely fascinating. So we started up the Acupuncture Center for Family Health, and subsequently the Acupuncture Center for Pain Relief, especially with Michael coming on, because he does have the two specialties as well of fertility and pain management and sports performance.
That's great. And again, I think that's why it complements chiropractic so much, because we're looking to balance the system before we chase down symptomology. We're looking at the whole person, not just individual parts. Thank you. That was great. So Michael, this question is to you.
Okay.
Candace was talking about the female challenges that you all work with, but I know that you also work with sports injuries. So first of all, tell me like the difference between the two. Is there a different protocol for each? and again, how you kind of fell into those two specialties.
Okay. With sports injuries, there's usually two common causes of it. It's either from trauma or overuse patterns. So a lot of times with acupuncture, the reason why it helps is because it helps promote blood flow and it increases the natural healing response to the injured area. Sometimes you have to restore balance to the area, especially when it comes to overuse patterns, because a lot of times repetitive motions cause imbalances in the musculature, which causes the joints to not track well, and over time creates inflammation, tendonitis, injuries, and like connective tissue tearing, or injuries to that. So what I really look for is restoring balance to the muscles and releasing trigger points which create tension in the muscles. So a lot of times, if you don't restore the balance around the joint, then when even though you reduce the pain, they start to, they'll come back again. As far as with the trigger points, how I see with trigger points is that it's almost like parking brakes put onto the musculature. And when a muscle is overloaded or when there's trauma to a muscle, whether it's like impact or whether you twist your ankle, the body tries to respond by contracting the muscles tightly, quickly, and it holds on to that tightness just to limit your range of motion so you don't get hurt. Over time, those trigger points cause imbalances and cause increase in pain, and we need to turn them off. So the needle works really well with, when I insert the needle into a trigger point, it creates a muscular contraction, and then it almost turns off those parking brakes, which restores the muscular balance. What I noticed over the years was that by releasing the trigger points after pain levels go down, that once those trigger points are released, actually sports performance increases because the muscle fibers are able to elongate and contract in its normal range of motion. And people notice that they have more power, more speed in their sports.
What days exactly will you be working on people at Network Chiropractic of Somerset?
What we decided to do is start on Fridays, starting from 3 to 7 o'clock. We start with a compressed window for now, and then as interest grows and as I get busier, then we're going to extend the hours and maybe possibly add another day if that works out.
What are we looking for besides reduced, symptomology? What else could they expect from the work?
So, like Candace mentioned, we look at the whole body. So most of the time when people are coming in with whatever reason they brought them there, whether it's pain or whether it's fertility issues, we look at all the systems. So when we do acupuncture, most of the time people start to notice that other things start to clear up.
So Candace, and the last bit to you is more logistics in nature. So how do people contact? So I realize that it's going to be in my office, which is more in Central Jersey, not North Jersey. How do they make an appointment? How much does it cost? Does insurance cover it? What should they do? Do they have to wear something special, or how does everything work?
Okay. So basically everything is still going to go through our office because it is a satellite clinic. You can call the number 908-719-1362, and someone will be happy to help and set up an appointment for you. And just say you want to see Michael in the North Brunswick office, and we'll set up the appointment. Michael is having an introductory rate for 1 month of $70 for not only the first visit, but for subsequent visits. Wow. So that's a really, really, really good price. And we did that because I really want to encourage people to try it, because typically once people try it, they fall in love with it. And I wanted to enable people to get over that hump. So after that promotion is over, the price will go up. Our usual prices are $90, and then the first visit is typically $130. We generally spend about an hour and a half with people on their first visit, It's a very detailed interview and intake. Then we have you get up on the table. We take a look at your tongue, feel your pulse, do some palpation, and then we get you treated. And most patients find themselves most comfortable in loose, comfortable clothing, something that can easily go up over the knee or over the elbows. And certainly we have drapes and other things if you come from work and you have like skinny jeans or something like that on that are, a little bit tight or uncomfortable. That's no problem. We do take insurance. We are out of network providers, but we are happy to submit a claim, and then you can get reimbursed, or you can talk to the office manager about the logistics of that.
Yeah, so that's great. Thank you for that. And again, I'm so very excited because I've been looking for, just like you two found each other, it was a perfect fit. Once I saw Michael again and I knew we had the open day in the office, I've been looking for a modality that would go very well with what we already do in our practice. And right now, especially, so many people are stressed more than they even realize. I'm just so grateful, Candace and Michael, that you guys are willing to extend your satellite down into my office. I'm so honored to have you both. And I think it's going to be amazing. I think people are going to take advantage of it. I know I am. So thank you again so much for your time today. And I really am looking forward to this magical partnership.
Oh, great. Thank you so much for having us. We really appreciated your time.
Thank you very much, Dave.
All right, guys. Have a great day.